Deuk Majin with the Deuk Spine Institute. It's Thursday, November 4th.
December 4th.
December 4th. That's what I thought. December 4th, 2025. And our patient travels here from Michigan because he has horrific back pain coming at the L5-S1 disc. We call it discogenic back pain. He also has facet pain on the sides of the disc at L4-5, L5-S1. We recommended facet treatment, but he didn't want to do it. He also has piriformis, torn piriformis muscle, but it's not bothering him too much right now, and he did not want to treat that either. So I told him, you may have to come back and get your facets and piriformis treated in the future. But right now, his primary pain is coming from the disc. So we're going to go and fix the L5-S1 disc. All right, any questions? Feel free to type them up, but we're going to get started. The first step here is to gain access to the disc through the foramen. The neural foramen is a natural opening in the spine. You have a left and a right. We're going to go through the left side. Are we ready, doctor? All right. The patient is sedated with our anesthesiologist, Dr. Berndes, at the helm. I want to get into the disc and hopefully be able to do what's called a discogram. The discogram, there's two types, evocative and something called a chromodiscogram. Evocative being we want to see if it's painful, therefore we need the patient's cooperation. Chromodiscogram is just color the disc either with radio opaque dye or another type of dye. We use both our Deuk spine dye and a radio opaque dye. Shot. All right, so if you have questions, feel free to ask. In the meantime, Henry, since we're talking about all the different causes of back pain, show us the L5-S1 disc there, Jordan. Can you guys see this disc right here? Show us the sacrum or tailbone. There's the sacrum. No, yeah, that whole ice cream cone right there tilted. Then the first disc above that is the L5-S1. That's the one this patient is having his pain coming from. And that's the one we're fixing today. Shot? Any questions? If not, let's show our audience the 30 different causes of back pain. I'm Dr. Deuk Majin with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deuk Machen. Thanks for joining us. Okay, welcome back to our live stream on December 4th, 2025 from Deuk Spine Institute. And again, I'm Dr. Deuk Machen, CEO and founder, here with my team, including Luis, Dr. Berndes. Our patient is asleep on his belly, and we are now inside the disc at L5-S1. Specifically, we're here to fix a very small tear in the back of that disc. That tear is honestly the size of a pea. Okay, a pea. You guys know what a pea is. I'm talking about that little vegetable called the pea. Maybe if you really want to accurate, it could be the size of maybe a garbanzo bean. But between a pea and a garbanzo bean. That is literally the small, tiny little area that is causing all of his back pain coming from this disc. Now, you all just watched our video. So you know that there are 30 specific causes of back pain. This patient has the disc at L5-S1. That's his number one cause. He has the facet joints on the side. So that's 2, 3. And then he has the piriformis muscle, which is number 4. So he has 4 causes of back pain. We're fixing only one because that's his choice. I offered to fix all 4. He said just fix the disc. The disc is the number one cause for him. When I ask him where your pain is, he points right here. So that's the main problem. He does have facet pain. He does have piriformis, but we're not treating those today. So he's awake now, and I'm going to test that disc to see whether or not it's causing pain. Now, he's under the drapes over there with the anesthesiologist. They're working on him, but he's awake, and we're going to be able to do what's called
How you doing, my friend?
an
You okay?
evocative discogram.
Well, he said he's okay.
Are you having any pain?
Can you hear us? Are you having any back pain now? No.
He's had back pain for 3 years. When did your back pain start? Yeah, what was the first time you ever had it? How many years ago? 15 years? All right, so he's had back pain for 15 years on and off, and this is typical. Just relax, you're doing great, we're going to put you back to sleep. But now for the last 3 years, folks, it's gotten constant, severe, to where it's totally affected his life. He's here with his wife, they're from Michigan. He came to Florida because this surgery that you're about to watch, this is the most advanced, in my opinion, the most advanced endoscopic spine surgery in the world, is only available at Deuk Spine Institute. It's been peer-reviewed and published, this procedure. It's FDA approved. But other doctors elsewhere, they don't want to do this procedure. Why? Because they don't make much money doing it. They make the least amount of money as a surgeon doing this procedure. Can we reduce that sound, please? All right. Are you comfy?
Are you having any pain right now? Is it pretty light?
Right. Oh, that disc is really scarred up. How bad is that on a scale of 1 to 10? How high does it go?
Give us a number.
What's the highest?
A 9.
9 out of 10 was the highest? Is that where you get your back pain typically? That is?
Yes.
All right. You get to go to sleep, my friend. When you wake up, that pain will be gone. So, great news, folks. You all just watched the video on the 30 different things that cause back pain. Remember, the back pain, the 30 different causes, includes this whole area here, okay? This whole area, but his worst pain is right there. That's right where the L5-S1 disc is. We just tested it, and it's causing 9 out of 10 pain for him. It's concordant, meaning that's the pain he gets every day, the worst pain. All right, if you have questions, I'll take them while we get started here.
This first question is coming from Thomas on YouTube, saying, "Good morning,
Hi,
Dr.
Thomas. Good morning.
Good morning, Dr. Deuk and crew. Do you
Good
use a special dye that locates when pain actively occurs so it takes the guesswork out of your surgeries?"
Well, that's a great question. So, to answer your question, Thomas is asking, do we use a special dye that localizes pain? The answer is no. There is no dye that will tell you where pain's coming from. I use my clinical judgment and my years of experience of curing back pain to know where the back pain sources are and how to fix them. Now, this back pain he has is literally coming from a small tear the size of a pea on the back of his disc at L5-S1. I'm going to go in with a laser and clean that tear. Can you count out loud from 1 to 100? Count out loud. So once I clean the tear with the laser, get rid of the inflammatory tissue in there, which is the cause of his pain. Get rid of the herniation stuck in the tear, which is the cause of the inflammation. That pain will be gone. He'll wake up and that pain is not going to be there anymore. By the way, we've lost 1 drop of blood. Literally 1 drop of blood this whole surgery so far. That's this procedure. You don't need to have invasive surgery. Don't have fusion anymore. Don't have discectomy. Don't have laminectomy. Those are old surgeries that don't work. They never cure back pain or neck pain. And more importantly, they're unnecessary, and everything they do can be done here with the laser procedure when it comes to symptom relief. Okay? Now, doctors are going to tell you need a laminectomy because you have spinal stenosis. You have a discectomy because you have a pinched nerve. You need a fusion because your spine is unstable. None of those things they're saying need treatment by the technique they're saying you need treatment. They can all be treated properly and better with the Deuk laser disc repair. That's why we don't recommend invasive surgery anymore to our patients. We recommend minimally invasive, and specifically the Deuk laser disc repair. There are a lot of doctors out there saying that they do, how's blood pressure? Let's get it down. Saying that they do minimally invasive surgery, but they really don't. All right? Let me show you what I'm talking about while we're waiting for the blood pressure to come down. Give me a ruler and a pen. This incision right here, folks, is 7 millimeters. 7 millimeters, okay? Look at it right there, 7 millimeters. It's less than a centimeter, okay? So 7 millimeters is basically just a quarter of an inch, okay? Quarter of an inch. Now, if you have a fusion at L5-S1, the incision is going to be like this. This is going to be like a 5-inch incision. How are we doing, guys? All right, so can we get his blood pressure rechecked? I want to make sure we're... Huh? All right, so we're just going to wait for a moment, let our anesthesiologist get the patient situated, and then we'll proceed. In the meantime, understand that all these other surgeries we're talking about are highly invasive, big incision, and when the surgeon cuts your skin from here to here, what you're not seeing is what's happening underneath the skin. All right, and like the tip of an iceberg, the incision is just the tip of the iceberg. Underneath there, they're using surgical instruments to cut through your soft tissue, to cut through the fascia, which is what holds, it's basically the tendon that holds the muscle to the spine. They're going to cut out your spinous process or part of it. They're going to cut out your lamina. These are all normal structures you don't want taken away. They hold your spine together. They keep your spine stable. They're normal parts of your spine that should never be removed. God intended them to be there for a reason, yet spine surgeons are removing lamina, removing muscle, removing fascia, removing tendons, removing ligaments, removing joints like your facet joints in order to get down and do what they need to do in your spine. Now, all that damage to your muscles, your ligaments, your tendons, your facet joints, your lamina, your spinous process, your interspinous ligament, your supraspinous ligament, all of that damage is completely unnecessary. It is not what the surgeons want to do. They're forced to do it because the technique they're using requires them to do it. I used to do those surgeries. I was trained to do those surgeries. But then somebody very smart, much smarter than me, figured out, well, we can avoid all that trauma to the patient's body under the skin if we go from the side. And we use a small tube, and this is called minimally invasive or ultra minimally invasive spine surgery. There's nothing less invasive than spine surgery than what you're seeing here. This is the least invasive of all spine surgery. How are we doing, guys? How much more time do you need, Dr. Berndes? I'm sorry? All right. Do we have any other questions, Henry?
Yes, we have a question from Lanu on YouTube.
I'm going to proceed when we get to 120 or lower. Hi, Lanu. Go ahead.
Asking a technical question. Can this surgery be done remotely?
This surgery cannot be done remotely. It requires you travel. Can you see the Eiffel Tower remotely? No. Can you see Mickey Mouse and experience Disney World remotely? No. So people are perfectly happy traveling to Paris to see the Eiffel Tower and visit Paris. How many million visitors a year to Paris? 40 million visitors a year. How many million visitors a year to Orlando, Florida? 80 million visitors a year to Orlando, Florida. Why do people travel with their families to Orlando? Because what Orlando has, the #1 tourist destination in the world, they have cannot be experienced virtually. Okay? Otherwise, people would just stay home and experience Orlando from home. Okay? So, surgery is far more complicated than Mickey Mouse or the Eiffel Tower, and especially spine surgery. So if you want to have the best spine surgery in the world, you have to travel to Orlando, Florida, along with 80 other million people a year to get your back or neck fixed at Deuk Spine Institute, because that's where we are. We're just outside of Orlando. All right, are we good? Yep. Let's try to get it down a little bit more, but I'm happier now. Any other questions?
At this moment, no current questions.
Yeah. more people are traveling in the year 2025 than ever before in the history of the world. So traveling should not be a problem. It should not be an excuse. Hold on. Go ahead. Shot. He's communicating quite well. All right, I'm going to wait for you just to put him a little bit deeper, and then we'll proceed. So we do these surgeries under twilight anesthesia, which means the patient is not under general. If you have a patient under general anesthesia, you can sedate them until they just completely out. And it doesn't matter if they stop breathing or not, because you have a tube down their throat. It's ventilating their lungs, giving them oxygen, taking away carbon dioxide. When you have a sedation patient like this, you don't have the tube down into their trachea, so the patient can stop breathing, and then they would just, it wouldn't be good for the patient. Let's put it that way. So we have to basically adjust their anesthetic to make them sedated enough so they're unaware of what's going on, give them pain medicine enough so that they don't feel pain, but keep them breathing. And that's called the plane, the anesthetic plane. And it's very, very difficult. It's probably the hardest anesthesia case you can do, besides kids, pediatrics, which is even harder. All right, any questions?
At this moment, no current questions.
So we have this patient.
Yep.
We're fixing L5-S1. Then we're going to go to another patient in the other room. We're going to fix his piriformis. He's from Orlando. And then we're going to finish up with a patient from Denver who is having his facet joints treated because he has facet joint pain. I need to put more cases on. We never have these problems when I have a lot of cases. Huh? All right, we're just waiting for the thumbs up from our anesthesiologist.
In the meantime, why don't we just got a question from Lanu once more on YouTube asking a movie question. When Star Wars came out in 1977, it was really good. Later, they make a whole bunch of versions of Star Wars. It was now it's bad. Did you notice?
Oh yeah, I 100% agree with you. I think the original Star Wars, The Empire Strikes Back, and The Return of the Jedi, made in the 70s, I think early 80s, they're the best. I don't even watch the other stuff because it's junk. I call it glam. Yes? Shot? All right, so I'm going to tell you right now, folks, this is a very tight disc. And I think we're good. So let's try to get this. He's clamping down with his muscles. Yeah. So we're doing the best we can. Thank God it's one level, right? Just hang in there, buddy. You're doing great. Fuck. Sure. Yeah. Anyway, go ahead, do your best. You called for the vice grip? No, it's okay. If we have to use it, we use it. Yeah, he's clamping down so hard we can't even get the dilator out. Give Berndes give Berndes one more chance to get him a little deeper, and then before you use the vice grip. The vice grip will destroy the dilator. We don't want to do that if we don't absolutely have to. Let me know when I can retry with this thing. Berndes, tell me when I can retry. Now? All right. So the problem is his disc is so collapsed and scarred up, it's clamping down on my tool. Yeah, we're almost out. I'm just dealing with my angina pectoris. Oh my God. What the hell? Look at this thing. The end must have been bent. Fuck. Unreal. So this guy's crushed my dilator. Oh, it's bent. You can see the bend right there.
The same when pulling it out, it looked bent.
Unbelievable. Well, we got it out. Unfortunately, these things do happen. It makes surgery challenging, but that's why you want a surgeon who does the right thing, given a sticky situation. There's a lot of surgeons out there that do the wrong thing, and they hurt the patient in doing so. Okay, heading down the pipe into the disc. Any questions so far?
And we have a question from Thomas once more on YouTube, asking, wonder whether you had watched Law Abiding Citizen yet?
No.
With Jamie Foxx.
No, I have not actually. Yeah, I have not watched The Law-Abiding Citizen yet.
Thank you.
I'll get around to it. What am I watching? I just watched, so there's a series of movies from the, early 2000s, 90s, early 2000s. How's he doing, Berndes? Good? Man, he is clamping down on this tube. Fucking hell. This guy is just fighting us really hard, but we're going to do our best here. Thank God it's one level. But I think he's crushed my tube as well. So for those of you who remember movies from the 90s, there was an actor who did a lot of martial arts. His name was Jet Li. And he did some really good movies. Really, really good drama martial art movies. And a lot of them were with DMX, which is a rapper from the 90s, very popular. So I just watched Romeo Must Die. Yeah, Kiss of the Dragon is another one. Really good, Kiss of the Dragon. These are really, really good martial art movies from the 90s. And I think from the Cradle to the Grave was another one. Right? Cradle to the Grave, Romeo Must Die, Kiss of the Dragon. Great martial art movies with Jet Li, who came along after, Jackie Chan and, of course, Bruce Lee. And he's phenomenal. And one of my favorite movies of all time that nobody knows about with Jet Li. It's called Contract Killer. Contract Killer. One of the best martial art dramas. Very few people know about it. It's very hard to find. I think Apple may have it. I don't know what other platforms. But Contract Killer with Jet Li. Phenomenal movie. All right. Making some progress here. Getting to the most painful part of the disc right here. Let's show the audience, Henry, how these disc injuries can be so painful. and how we fix them with the laser.
Of course.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922. Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A quarter-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Got about 2 minutes left, Burn does. All right, welcome back. We're just about finished. This was a very painful disc for the patient, and we've had a really hard time with him because of his response to anesthesia has been not good. And the visibility has been not good either for the scope, right, because of the bleeding. But this is the last part of the herniation, and it's really it's been a challenging case for the surgeon and the anesthesiologist. Hold on, I'm just having a hard time seeing. I'm gonna have to put this in and get a better view. I have about 2 minutes left. There it is. So you can see the inside of the disc here. We're just on the outside of the disc looking in through the tear that was in the back of the disc. These are all pieces of herniation coming out. I need about a minute, Berndes, 1 minute. You doing okay? 1 minute.
We have another question
Sure.
coming from Lanu once more on YouTube.
Hi, Lanu. Yeah. Uh-huh.
Asking, the patient's bone looks stiff. I wonder if it's aging.
No, the bone is not the problem. The problem is the joint. The joint is stiff because scar tissue from all the inflammation. He's had back pain for 15 years, but it's gotten really bad in the last 3 years. And that whole 15 years, he's been having this inflammation happening. Imagine inflammation happening in one part of your body just for 15 years. That it's going to cause a lot of damage. And that's exactly what we're looking at here. We're looking at the damaged disc. And inflammation that goes on creates scar tissue. So every moment, every day that inflammation is going on, it's creating another day of scar tissue. So imagine 15 years worth of scar tissue. All right? That's what we're dealing with here. This disc right here is been scarring for 15 years. That's a piece of herniation right there. I need 30 seconds and I'm done. We're literally outside the disc, the annular tear. We've cleaned it. I've just got a little bit more to do and we'll be done. Yeah, he's feeling that because this is so painful, this area. It's such a painful area for him. I think he's going to do really well once we're done. All right, 10 seconds. Done. There's no more herniation to take out. We've gotten it all. It's just been kind of a mess. I wish people would come to me sooner. You know, maybe 15 years ago when his pain started. You know, give it about 3 months to try to heal up. If it doesn't go away after a few months, it's not going to go away on its own. Come to Deuk Spine. Get the Deuk laser disc repair. Prevent your disc from degenerating all the way down, collapsing like his, and scarring itself tremendously, getting scarred up. That's what our procedure can help you do. Avoid disc degeneration. All right, coming out. We're done. Like I said, he's got a few other causes of back pain that we'll address in the future for him. But this went well. It was very difficult for the anesthesiologist, very difficult for me because the disc space was so collapsed, and he was cramping down. His muscles were just so tight, pushing down on the disc and squeezing my endoscopic tube and just grabbing it and holding it. So anyway, we're done. Any other questions? Yeah, we got a good discogram.
No current questions.
All right, we'll be back a little later for a cervical facet pain treatment. Patient with bilateral injuries to facet joints from C3 to T1. We're going to go in and destroy the pain nerves so he can have some permanent relief of his facet pain in his neck. You guys see the incision is beautiful. It's tiny. We're going to get those staples out tomorrow morning and send him back to Michigan with steri strips and hopefully some improvement in his back pain. Dr. Dumajan. I'm here with one of my lovely patients who came to Deuk Spine Institute with a problem with his lower back. I can tell you he's had a laminectomy before. It didn't work. He looked us up, came here yesterday, had the Deuk laser disc repair. We fixed 5 areas on his disc. And how are you doing today?
I'm very emotional. I got home yesterday and the sunset was behind me, and my wife took a picture of me thanking God for what happened to me yesterday. I've had back pain since 1973. I got hurt in the Army, putting helicopter blades back on a helicopter. I lived with it for over 50 years, pain. 3 years ago, the VA decided to cut 3 bones off my spine. I've been unstable and on a walker ever since. My life has deteriorated immensely. I was 280 pounds 3 years ago. I'm barely 200 pounds now, and it's not because I wanted to lose the weight. All my muscle is gone because of what happened before.
And did the VA surgery fix your problem?
It made it worse.
That was a laminectomy.
That, when they cut the bones off my spine, whatever you call it. But the thing about it is that after that, it took me 3 years to even get them to, I was at 30% disability to begin with, and it took them 3 years to get me to 80. And then now I'm at 90, but I haven't been able to work. I haven't been able to mow my lawn. I can't ride my Harley Davidson anymore because of the surgery that they did, the instability. I've been in the ER 15 times since that surgery from falls. It's the worst feeling in the world to be a 280-pound farm boy down to a 200-pound, very weak-minded, weak strength. I can't get up and go do anything without a walker or somebody with me until yesterday. What you did for me yesterday, there's no amount of thankfulness that I can show you or tell you, except that I took you for a man of your words, and you came through for me. I walked in here without my walker. I've been walking around this morning without my walker, and I don't feel like I'm gonna fall. I'm not afraid anymore. I got hope again. I got hope to be a man again and be self-worth.
You had the Deuk laser disc repair. We went in and fixed 3 discs, but 2 of the discs from both sides because the nerves were being pinched on both sides. And now you're walking without the walker. Do you feel like a new man?
I feel like a new man, but hopeful to be a great man again. And I thank you with all my heart. My family thanks you.
You're welcome. And you can see in the surgery we did on your back that we went in with the laser and we cleaned out the tears and got rid of the herniations, and now your discs will heal naturally. We didn't put anything artificial in your back. You have your natural spine. You didn't need the laminectomy that the VA did. It was unnecessary, and it put you through a lot of pain and suffering. Are you on any pain medication today?
I didn't even take Tylenol for my neck at all. I have no pain anywhere in my body, none. I can feel one spot that it feels like something happened there, but it's not painful at all.
Well, is there anything you want to tell your people out there?
Anybody needs to check with this clinic and this man right here and the staff here. It's just absolutely unbelievably wonderful. I got treated with so much dignity and fun, actually, yesterday. It was a blast. Anybody that has questions, do not allow people to cut into your back until you do research. And this is where you need to start your research.
Thank you. Thank you.
I appreciate it so much.
Well, we love our patients, and we especially love our veterans who are patients.
This one sure was you, Woody. Thank you so much.
Take care. You take
God bless you all.
Thank you.